some of us, we've been around for quite a long time. And actually, Larry, Nick, I think we're three of the founding fathers that were here right now. This has been 25 years this year that we started this. So we've been together for 25 years. It's amazing. We're all only, 26, 30 years old. It's amazing. We started this when we were kids. So it's been a great group. It's been a great group of guys and offices to be associated with. And it's helped all of us in the to grow and to be able to help many, many people over the course of the last 25 years. If you really think about it, we're getting into the hundreds of thousands of lives that we've been able to touch and to help. Today's first speaker is a very good friend of ours, Dr. Mike Mills. Mike's been in practice for 9 years now. Practices up in Katanning. Dr. Mills.
Good morning. Gary's introduction helps out a little bit because usually when I'm with these guys, they're really surprised that someone this young would be part of the group. We had our Christmas party and John Gump was there, and so since he's not here, we're going to talk about him. And Rom was there, and Rom had his date with him for the night, and he was introducing everybody, and they introduced John Gump, and I said, I'm his grandson. And she didn't know any different, so John didn't think it was really funny, but it was nice. So, yeah, I've been in practice in Katanning for 9 years. Every one of us has a different style of practice, maybe a different philosophy of practice, different techniques that we use on patients, but really what draws us together is our philosophy. And that's what I want to try to give us today, is a little bit of philosophy about chiropractic and the why behind what we do and why that's important and how our chiropractic philosophy brings us together. Because, every one of us come to work every day, doctors, staff, to try to help as many people as we possibly can. So what I want to do kind of to get us started, to help set the stage of why it's so important that we do what we do every day, I'm going to go through some statistics with you. And these are motivating to me. I think you'll find them very motivating to yourself. But this is something that was put out by the World Health Organization. And what the World Health Organization has 191 countries in it. And they study different things. They study how effective healthcare systems are. They study how effective individual nations are as far as how healthy they really are. And out of 191 countries in the World Health Organization, who do you think spends more money on healthcare than any country in the world? The United States, right? We spend millions of more dollars every day, literally, on healthcare than any country in the world. However, our healthcare system ranks 37th. So really, there's 36 other healthcare systems that, according to their statistics, are more effective at providing healthcare for their individuals or for their population. As far as health is concerned, our health as a nation ranks 72nd. So literally, there's 71 other countries in the world that have a better life expectancy, have a better health than people in America, which usually goes against what we've been taught. We kind of think we have the best healthcare system in the world, and we're the healthiest people in the world. And but the way I kind of think of it is, could you name 71 other countries, really? If I had to stand here and just name 71 other countries, I couldn't even do it. So that means countries that you've never heard of, never been to, never even thought of, literally the people there have better qualities of life, less chronic disease, better fertility rates, things like that. So let me give you some statistics. This is from the February 17th Journal of the American Medical Association. 1 in 2 children in America have a chronic health condition lasting at least 12 months. Think about that. In America right now, 1 in 2 children have a chronic health condition lasting more than 12 months. Right now, depending on the statistics of what you read, you can read it anywhere between 40 to 60% of our children are obese in America, right? If you're obese by the time you're 18, you're twice as likely to die by the time you're 55. So if you're obese by the time you're 18 years old, you're twice as likely to die by the time you're 55. Literally, if you're obese in your teenage years, you literally, your cardiovascular system functions as if you've had 1 heart attack. That's literally the damage that's being done. In 1985, there were 500,000 cases of attention deficit disorder. Today, there's somewhere between 7 to 10 million cases of attention deficit disorder. There are now 1 in 100, out of 150 live births in America, 1 child will be autistic. Of boys born in America, 1 of 90 boys will be autistic. Autism has increased in the 90s, asthma has increased in the 90s 75%. There's been a 75% increase in asthma in the 1990s. The average American will get 11.5 prescriptions per year. We now spend $291.5 billion annually on prescription drugs alone. No surgeries, no nothing. $291 billion annually in America for prescription drugs alone. Direct-to-consumer marketing, right? So we're not talking about marketing to doctors or to hospitals or anything like that. Direct-to-consumer marketing for antidepressant drugs alone, only antidepressants, is $122 million a year. That's what we're competing with in our chiropractic offices every single day. They just did a release of a study. They said, are we healthier? Over the last 10 years, the health of America has declined, not increased. Prescription drug abuse is at an all-time high. If you're a woman between 45 and 64, you will be shocked to hear this stat. Between 1990 and 2005, the rate of poisoning deaths doses raised 230%. So if you're a woman between 45 and 64, the number of poisoning deaths increased 230% from what? Prescription drugs. One prescription drug was just removed from the market, Ativan. It's a diabetes drug, right? This drug caused 500 heart attacks and 300 cases of heart failure per month. Per month. So why am I standing up here telling you all this information? Because the reality is, the current healthcare system that is in place, that's not progress, right? If asthma increased by 75%, are we getting better or worse? If attention deficit is increased from 500,000 cases to 7 to 10 million cases, is it getting better or worse? If we have 1 in 90 boys now being born with autism, is that getting better or worse? Worse. You know that my children are the first generation in the history of America to be predicted to not outlive me and my wife, life expectancy-wise. We are now raising the first generation of children in America that are predicted to not live as long as their parents did. So why are we here today? Because that's not acceptable. We live in the richest, most affluent country in the world, and that's just not acceptable. My question to you is, if we don't do something about it as chiropractors, who's going to address it? Who do you refer these people to, other than the current system that's in place, to help these children? Right? We have to step up. You have to have a big office. I have to have a big office. We have to help hundreds of people. Why? Because lives are depending on it. 1 in 2 children in America have a chronic health disease lasting greater than 12 months. It's just not acceptable. So who's going to stand up and defend them? I mean, let's face it. We have a system that's exhausting our economy, isn't it? We spend $291 million just on prescription drugs alone, right? Listen, we spend $38 million a day on just the fractures associated with just hip fractures. Just hip fractures, just the surgeries associated with that. Not treating it, just the surgeries cost us $38 million a day. What could you do with $38 million a day to make America healthier? How many chiropractic adjustments would that give? How much education would those patients get about health and nutrition and exercise and wellness and subluxation? How much education would they get? How much of this could we prevent? You know, we're to the point where the insurance is exhausted. The person has taken a second mortgage on the house. It's exhausted. Now everybody's walking around some sports field somewhere raising money so we can have more money to dump into a system that is doing what? We have a cancer rate of 1 in 2 people now. 1 in 2 Americans are going to get cancer. So look around this room. This half of the room is going to end up with cancer. Statistically, according to American statistics, right? So is spending more money fixing the problem? Do we have better drugs today than we did 50 years ago? Do we have better surgeries today than we did 50 years ago? Do you know we have more hospital beds per person in America now than at any point in the history of our country? We have more nurses per person than at any point in the history of our country. You have access to medications. People are taking more prescriptions per day now than any other time in our country. Americans get more surgeries per year than any other time in our country. What I'm saying is what we're doing is not working. It's just not working. If it was working, all those things would be declining, not increasing, correct? So who is going to solve the problem if we don't step up and be that person? So how do we step up and do that? Well, you know, the simplest way is just to simply do the procedures that are set in our offices in front of us every day. Do the fundamentals right every day. Educate patients about what we do. Because the reality is behavioral modification doesn't work. We've been trying to tell people don't do this and do this for too long, right? If I tell you, eat broccoli, and you say, I hate broccoli. Eat broccoli. I hate broccoli. Eat broccoli. I hate broccoli. How long is that going to last? Until it goes shh. Right? What we have to do is change people's beliefs about health. Change what they think about health. Change their understanding, their paradigm. That's what we're going to talk about today. Our lives begin to end the day we become silent about the things that matter. You know, that's my greatest concern for chiropractic. My greatest concern is that we become silent about the things that matter.